we're moving on to case study 3, and those of you that joined for the first session will recognise Izzy, who also did a scenario for us in our first session. So Izzy's scenario is about an unexpected outcome and how to deal with the fallout when something goes wrong and you're not expecting it. So Izzy graduated from the University of Liverpool in 2018. She took 6 months off after graduation to volunteer abroad for veterinary charities. Izzy joined the Blue Cross graduate scheme in January 2019, working both at London hospitals and in Grimsby. Since completing the graduate scheme in 2020, she has been kept on as a vet at the Blue Cross in London. So Chloe, can we play Izzy's video, please? And Fabi and I will look up notifiable diseases while we're watching.
My name's Izzy. I'm a vet at the Blue Cross. I graduated from Liverpool University in 2018, but I didn't start on the grad scheme at the Blue Cross until 2019. A difficult situation that I had kind of in the first kind of 18 months of practice was last Christmas Eve. I was on my own sole charge working the late shift, and I had a dog come down with a history of maybe having eaten something funny. And it arrived at the clinic when I also had about 4 things already waiting in the waiting room, really flat. So we brought it straight through, and me and my nurses kind of placed an IV, started taking a blood sample, started shock rate fluids. I then sent my nurse out to kind of chat to the owner and get a bit of a history and say how sick the dog was. But it was all a bit of a blur. We were doing kind of everything we could. I went out to then speak to the owner and say, I think your dog's really sick and might not make it. At which point one of the nurses runs out and says she started crashing. It was a really stressful situation. It was still at the point where we weren't able to let the clients into the consult room because of COVID. And we kind of set about kind of our CPR protocol, giving adrenaline, chest compressions, intubated the dog, spent about 10 minutes doing everything we could, but we couldn't get the dog back. And it was a relatively elderly dog. And me and the nurses agreed, actually, we probably aren't going to be able to fix this dog, even if we get it back. And so we kind of elected to stop CPR. Whilst we were having that discussion, we sent one of the nurses out to chat to the client and explain that the dog had crashed and that we didn't think she was going to wake up and that we were going to have to let her go. Afterwards, I mean, it was all, like I say, a real blur and a really stressful situation. I did let the client in to come and say goodbye to the dog once she'd gone. At that point, the dog still had kind of a tube down her throat. She was, had lots of kind of drips coming out of her and IVs and that sort of thing. And the client was just in total shock. I tried to explain everything as best I could, and they felt really confused about what had happened. They said she was fine this morning. Why she died, And as a vet who hasn't even been able to run diagnostics, I said, I really don't know. I tried to explain everything to them. We even discussed post-mortems, saying that they could pay for her to go for a post-mortem if they wanted answers. And then their neighbour arrived, and I chatted to their neighbour as well, but everyone was just so shocked. It was a really horrible situation. I had a really bad feeling anyway, because it was just one of those scenarios where you don't feel in control of the situation. So sometimes when I get a feeling like that, I'm really on it with my notes. So I wrote really, really thorough clinical notes about every step of what we did, the decision making, what I discussed with the owner afterwards, because I was a bit worried that actually, they might come back asking for answers at some point. They didn't initially, so it was a really stressful case, and it really hung over me for the whole Christmas period, but they didn't seem to come back, and I was like, well, obviously that went okay. And then in March this year, they sent a letter to the head vet of the hospital saying, we want to know what happened. It wasn't a specific complaint, but they just felt that they didn't know what had gone on, and they were really, really upset and struggling to grieve the dog, and they wanted a written statement from me about what had happened. Luckily, because I'd written all of those notes, and because it was quite stressful, I could remember everything that happened on the case, and I could use my notes to try and kind of write them a little timeline of what had happened and the decision making, and why she'd had a tube down her throat when they came to say goodbye, or why she had drips in her legs and things. And once they got the written statement, they kind of felt actually they did understand why it happened. And although we may never know why it happened, I think they felt that they could understand what had happened that night, and they retracted any kind of complaint or anything, and they just really had wanted it in writing, explained to them what had happened. So it was one where I was really, really grateful that I'd been sensible and sat down and stayed a little bit late, you know, stayed 20 minutes late after work, just documenting everything that happened. In terms of what I do differently, you know, now, I mean, I always feel like I could be better at CPR. I think it's something that we don't leave vet school feeling really confident of. And you always think, oh, if I'd known more or been able to have more members of staff, would we be able to get this dog back? But she was really, really sick. And I don't know that we would. But we do try and have regular CPR kind of days at work where we try and go over it. But yeah, so I suppose the only thing I'd do differently is maybe, you know, improve my knowledge and kind of control of CPR situations to see if we can get them back. But I do think this was just one of those really sad cases, and at least I'd written all my notes really clearly.
Okay, so I'm just going to share my screen again. And I think what Izzy just said there about this is one of those really sad cases. Sometimes they're the hardest, aren't they? When you don't really know what's happened, but it's happened and it doesn't really feel like there was anything you could have done. And those can be the hardest. So it's really interesting what she just said. Just to go, before we discuss Izzy's scenario, so Fabian, your question about notifiable diseases. So it's paragraph 14.31 of the supporting guidance, which says that veterinary surgeons and veterinary nurses must disclose information to satisfy specific statutory requirements, such as a notification of known or suspected case of certain infectious diseases. So that's what we're talking about. Where such a statutory requirement exists, a client's consent to disclose is not necessary, but where practicable, the client should be made aware of the disclosure and the reasons for this. So there you are, paragraph 14.31. Okay, so coming back to Izzy's case, do any of you have any thoughts about that? Is it something that you recognise from your own experience? Is it something that you've had to deal with, a kind of really difficult situation, and you thought, you know what, I'm just going to make really good notes about this, I've got a bit of a bad feeling? You're welcome. So I think what's really interesting about this case is obviously the RCVS, our view is that clinical notes are always important, they're always essential, and they're used for so many reasons. You know, it ensures good continuity of care, it ensures that everybody knows what's going on, make sure that mistakes aren't made, you can see what medications have been taken, and all of that kind of stuff, protects animal welfare in that way. But in this case, it's just a really good demonstration of the fact that when things happen suddenly or when an outcome's unexpected, that's when clinical notes are just absolutely crucial, because clients may feel that they don't understand what's happened and they want to talk about it. And so in Izzy's case, the fact that she was able to kind of take the time to really note down what had happened, she was then able to deal with that situation and kind of draw a line under it at a later stage. And I wonder if in this case, if Izzy had not have made such good notes and wasn't able to deal with the client's queries all that time later in the way that she did, whether it would have de-escalated in that way, or whether the client would have felt the need to make a formal complaint or even make a complaint to the RCVS about what had happened. But the fact that Izzy was able to deal with the issues, I think probably in that case de-escalated things. So it's a great demonstration of why clinical notes are so important. So Anna in the chat says, I had clients decline certain treatment and then come back and tell my boss that they were not offered it at all, but my notes can prove that I did explain everything and offered the said treatment. Yeah, exactly. It's kind of it's a way to protect yourself as well, especially when you feel like I'm not sure the clients are really understanding what I'm saying here, or where you're not sure it's really coming across. So Samantha says, in my role, I attend civil court for recovery of debts accrued in practice. Good clinical notes are invaluable. Absolutely. So anything where you might have to refer to them later, good clinical notes, absolutely crucial. So let's have a look at the supporting guidance and the code on this one. So we've got a few to look at here. So the communication paragraph again, ensuring informed consent is obtained before treatments and procedures are carried out. So that's kind of your good communication skills. So it is your obligation to keep clear, accurate and detailed clinical and client records. And veterinary surgeons must respond promptly, fully and courteously to clients' complaints and criticism, which in this case, obviously, Izzy did. The beginning of the chapter is kind of about practical stuff, what to include in your clinical notes, so your details of the examination, treatment plans, and so on. 13.2 talks about taking care in writing records or recording a client's personal details to ensure that they're clear, legible, accurate, and appropriately detailed. And then goes on to give a little bit of information about the style of them. So objective, factual, and avoid making personal observations or assumptions about clients' motivations, financial circumstances, or other matters. Sorry, I've skipped ahead too far there. So those are the key ones to bear in mind when you're thinking about your clinical and your clinical notes and your client records. And there is an entire chapter, again, chapter 13 of the supporting guidance that deals with this. So if you are going into practice or you are already in practice but haven't seen it before, please do take a look at chapter 13 so you can get an idea of how to keep those clinical notes in line with the guidance.